Ranking member of the House Ways and Means Committee, Congressman Dave Camp, who's here to give the details on the House Republicans' plan for health care. That's going to be presented later this morning. Congressman, thanks very much for coming on the show this morning. A lot of people at these book signings that we go to say, what are the Republicans' plan? What are their options? What are they putting on the table? So you're here to tell us. And you actually helped write this plan. Why is it better than what the Democrats have put forward?
Well, Mika, thanks for having me on this morning. Good morning. First, let me say we've got an American plan, one that'll make health care more affordable, more accessible, and more available. And we think it's important to help bring savings to people in health care. You know, I hear everywhere I go how health care costs are making it harder for people to provide insurance. And so what we do is we've got some great ideas, and I think it's important to say that we want to be part of this debate. We want to make sure that our ideas are either incorporated into a final product or provide an alternative that people can rally around. And what we do is, first, we have a pretty beefy oversight on waste, fraud, and abuse in health care. We're going to have a significant piece on liability reform. I don't think you can have a serious discussion about health care without having at least some liability reform in the bill. And so we think that these are some great ideas that'll help move health care forward.
All right, and in terms of cost, I'm going to let Dylan Ratigan jump in, because a couple of the Republicans, Dylan, that I've spoken to in the past say we've got a plan that doesn't cost any money.
Right. Well, you know.
Meanwhile, the president definitely sees it differently.
Yeah. Well, they've got a magic credit card in Washington they've been using for about 2 decades. So you know, you can pay for a lot of things that way. Representative Camp, I'm curious how you manage for the decision-making. In other words, are you envisioning single payer? Are you envisioning some sort of rulemaking for the health insurers? Are you envisioning some sort of forced savings for the patient? When it comes to the actual health care, who's paying out and how is that money being collected?
Well, first let me say that we're going to try to incentivize people to be able to go into the insurance market and get health care.
How?
I think that's going to be important. We've got a number of ways to do that. For example, if you just say that people under the age of 25 who are dependents going to college or maybe getting on that 6-year program can stay on their parents' health insurance. That covers 7 million people there. That's a fairly simple, easy fix that we want to do. But that's part of our bill. But one of the things we don't want to have is the solution costs more than the problem.
Right.
And what we've seen on some of these bills that are being scored now is that the cost of them is bigger than the GDP of most countries.
Yep.
And particularly the Kennedy-Dodd bill, which we're now hearing numbers as high as $4 trillion.
Yeah, but that's a separate conversation. We'll talk. Because you're here to talk about your plan. I'm just curious how else. Again, the adding the young adult children is an interesting idea, but you still have basically between the age of 25 and 65, let's say, where there's a lot of inconsistency, and you can't blame a lot of young, healthy people who look at expensive health care at 30 years old or 29 years old or 34 years old and say, listen, I'm going to roll the dice. I don't think I'm going to need $4,000 or $5,000 worth of health care this year, which was what my insurance would cost, so I'm not doing it. Why is the government not mandate everybody in America must have health insurance a la Massachusetts?
Well, one of the problems with doing that is, and we've got an estimate on that, and it would cost about $300 billion to provide an employer mandate. And if you plug that number into Dr. Christina Romer's analysis, we lose over 4 million jobs. We don't think that's the direction to go.
Hold on 1 second, though. If those 4 million jobs are there because we have the most bloated and inefficient healthcare system in the world, and as we move to a more efficient healthcare system, by the way, we'll have to do this with education too, is it not a more intelligent decision to try to manage for the most efficient healthcare system possible and then try to create jobs in other places as opposed to trying to perpetuate an inefficient system simply because we don't want to deal with the consequences of creating a better system, which includes some labor reassignment?
Well, clearly, there are things that can be done to make healthcare more efficient, and I think we go after that with our provisions on waste, fraud, and abuse. I think those are important. But look, anybody who would say that it's okay to just drop 4 million jobs out of any sector of our economy, I think it's a real concern.
That goes without saying. But at the end of the day, we're a country that is spending more per capita on health care, as you know, as we do also, by the way, on education. I don't want to just beat up on health care, but we have a culture in this country where we believe that the more we spend, the better off we'll be, even though our yields, the actual output per dollar, is atrocious. And I suppose that's what you're talking about. I just don't understand exactly how you you think we navigate that?
Well, we are spending twice what the Canadians do and 2.5 times what the British do on health care. We think that is the focus of our plan. How do we bring costs down?
Mine too.
For Americans. And let me just say, our cancer survivor rates are twice as good as those of the Europeans and the Canadians, for
sure.
example.
And if we had a magic credit card that could pay for everybody in America to get $10 million worth of health care in the last year of their life, we could make everybody live forever. We have the best medical technology in the world, and I'm sorry to cut you here, but the issue is not can we make people live forever. We've got those guys at GE will make machines that'll make me live to 500, I bet. The question is, where do we make those decisions? So does he. Where do we make those decisions in terms of resource allocation, and how do you make a system that uses human nature to help you, not hurt you?
Well, look, we think the way is not to lose the positive things that we have in our system, like decisions made between doctors and patients. And if you need care, you get it immediately in America. You don't wait. So we don't want to go the European model. It is about bringing costs down in health care. You need to have serious reform of medical malpractice. You have to have serious reform. We also make administrative changes so that it's more possible for small businesses to offer health insurance at a lower cost by having a greater pool of individuals who can apply for that insurance. So we do that for individuals, we do that for small businesses. We think that's important, but also that we don't lose the health care that so many people have through their employer. Between 160 and 180 million Americans have health care. We want them to keep that.
Congressman, see, I'm not hearing any bad ideas here. I never really do when we have this discussion. I guess the question is how to carry it out, Pat, how to make the choices, how to prioritize, and in this case, with this administration, how to do it in the time that they're trying to do it in.
Well, I think you're right. It's very complex and it's very problematic. But let me ask the Congressman, when you talk about the 47 million unemployed, 47 million without health insurance, are we talking here, and the number grows, are you talking about immigrants coming into the country and illegal aliens in the country? Because the number continues to grow, and are these groups going to be covered by national health insurance, which would be an enormous magnet, frankly, for folks to come into the United States legally or illegally?
Good question.
Well, Pat, is a good question. You really have to look at that number, and it's very similar to the debate on welfare, that people come in and out of that uninsured population. It isn't a static number. And we believe that we can make real progress on covering the uninsured. I would not support taxing the American people to provide health insurance to non-citizens. So our focus is going to be on those people, particularly those who are working, who don't have insurance provided through their employer, or who can't afford the insurance they have. We want to bring costs down in the system. We think we can insure a significant portion of the uninsured. Our goal is obviously to have every American have access to quality health insurance. But I think to raise taxes in the level of $1, $2, $3, $4 trillion, where it would not be a viable way to address this problem. So we're trying to get at the administrative reforms, the incentives for individuals to offer insurance, and for the ability of companies to make sure they maintain the care they are giving employees now.
Mike.
Hey, Congressman, I'm in charge of dumb questions of the day. I'm going to assume that you like your congressional health plan very much. How come we can't get the congressional health plan transferred to every American? Same plan you people have.
Look, I think that's an admirable goal. We ought to try to do that. Our plan isn't perfect either, but it is a costly plan. And one of the things that we want to make sure is that people have access to a low-cost insurance plan if they want to have that. High deductible, for example.
Okay, Congressman Camp, thank you very much. Thanks for being on the show this morning.
Thanks a lot.
Coming up next.